Hi, I'm Dr. Lana Melendres-Groves, a Pulmonary Arterial Hypertension Specialist and Director of the Pulmonary Hypertension Program at the University of New Mexico. So, what is PAH, or Pulmonary Arterial Hypertension? PAH begins when the walls of the blood vessels in the lungs thicken and become more narrow. Because the blood vessels become more narrow, it's harder for the blood to pass through them. The reduced blood flow that is caused by the narrowed vessels creates increased pressure on the right side of the heart. The right side of the heart tries to compensate by working harder to pump blood through the vessels and into the lungs. Over time, the heart struggles to maintain this level of intensity. It's like asking your heart to run a marathon every minute of every day, and PAH symptoms result. Because sending blood to the lungs is somewhat easier than pumping blood to the entire body, the right ventricle was not designed to work quite as hard as the left. But working so hard to compensate for narrowed blood vessels causes the right side of the heart to enlarge and eventually to weaken so that it wears out and is no longer able to keep up. One analogy that can help with understanding PAH is traffic on a 5-lane highway. The highway represents the blood vessels, and the cars represent the blood cells. Watch what happens to the traffic flow when there is construction. If 2 lanes on the 5-lane highway are closed for construction, it's harder for the cars to get through. Traffic flow slows down, and the cars back up behind the lane closure, causing a traffic jam. In your body, narrowed blood vessels cause the blood flow to slow and back up into the right side of the heart as it struggles to keep up. This means less blood is able to get pushed through the lungs to pick up oxygen. You are likely familiar with at least some of the PAH symptoms, like shortness of breath, a rapid, hard, irregular heartbeat, chest pain, swollen ankles, a swollen abdomen, or even dizziness and fainting. Over time, as the disease progresses, the symptoms get worse, and you may find that you cannot do as much physically. It's important to note that symptoms may not always reflect whether PAH is progressing or how it is affecting your body. Even if your symptoms remain the same, there still may be more you can do to help improve how you feel. Things to remember. PAH is a disease of high blood pressure within the blood vessels of the lungs that leads to right heart damage and eventually heart failure. The symptoms that you feel are a reflection of how your heart is struggling, and they will not improve without treatment. PAH is a progressive disease, meaning that it will get worse over time, but the rate of progression varies. Be proactive by finding a doctor who specializes in PAH and ask about things you may be able to do now to reduce symptoms and help slow disease progression.